Well, I'll tell you what, 7 o'clock. Why don't we call this meeting of the Norfolk Board of Health on October 14th, 2020, virtual Zoom meeting to order. First item on the agenda. We have minutes to consider from September 15th. Are there any comments, concerns, complaints? Approval
No, I did a quick
ideas?
glance at it. I didn't check for spelling or anything, but
Yeah, that sounds like my view too. Looked everything was okay. Eileen, did you find anything in the minutes?
Also doing I did a quick review, but I did not see anything in particular.
good.
Yeah.
Perfect.
Well, are we
I-
prepared to say
yeah.
good job, Betsy?
What's that, Tom?
I said, are we prepared to vote good job, Betsy?
Yes, good job, Betsy. I make a motion to say good job, Betsy.
I second that
It's
motion.
effectively the same thing as approval of the minutes. Is there a second? I heard one.
Yep.
Yeah.
Great. That's
All
what I
all in favor, please say aye.
Aye.
Aye. All right. On to new business, new old business. Halloween discussion. We had a discussion last time.
We did, and I think the general consensus was to follow CDC and DPH guidelines.
Yeah.
I actually do have, if I can have them here in my Google Drive.
Do you have the thing that's posted to virtual Norfolk?
Yeah.
Yeah.
So this one,
The safety tips?
this
Yeah.
Yep.
I saw that, yeah.
This is posted on the town web main page and also on our Board of Health webpage.
Perfect.
Mhm.
And then there's also this one here. And then this one here, this one was another one that was put out that DPH had sent us, and I also posted that one on our webpage. So,
Uh-huh.
That's perfect. Common sense.
right. So
Basically, yeah.
I'll-
I think a lot of the neighbors in this neck of the woods are either not going to, or it's going to be done with a bunch of candy on a cookie tray, some distance away from the front door.
Yep.
And,
Right. I know that the Lions Club, you know, they sent us their plan for the haunted car crawl.
Yeah.
And then Norfolk CPAC is also doing for the H Olive Day students the trunk or treat. So I think we've all reviewed their plans and
All right.
seem to be in agreement that they're all following all the, you know, the COVID guidelines.
Well, I don't want to seem complacent, but you know, we do live in a town where the number of active COVID cases is pretty tiny.
Yeah.
So,
Let's keep it that way.
well, exactly. All right. Any other COVID related questions?
No, I think I'll just a couple things. I sent you the email from Paul Zinni. They've
Yeah.
they're moving forward with, I think, their phase 3 of their reopening plan. I think
Tomorrow. Yeah.
actually.
Good.
Right. So they're going to 40% in person, which is, I think, where the elementary schools have been all along.
Yeah, I think, yes.
So they seemed pretty comfortable with that. I think the data suggests that it should be okay. And that's it for other COVID information?
I had actually did some research about the issue with Ann's Market and the employee who wasn't able to wear a mask.
Mhm.
And there was some information online, like through the ADA website, so Americans with Disabilities Act, plus some employment law information. I can send it to you through emails to everybody. It was just, again, I pulled some stuff off the internet to try to define if there was actually things that employers could do if their employees were either unable or refused to wear a mask. So, because a lot of stuff you find is basically, people coming into your facilities that aren't wearing masks, and what are you able to do? But this was more as an employer, and it was hard to find some decent information, but I pulled up a couple of things, and I can send that on in case we get any other complaints.
Thank you.
Yeah, just send it along. Can you give us like a 1-minute synopsis, or is it too complicated for that?
I mean, it's hard to say, because again, you try to do all the things that you can try to do too. So what we had suggested, which was, move the person to a different job, not dealing with the public, or, putting up the plexiglass barriers. And, but he, obviously has a very specific situation that doesn't permit him to, move his employee out of contact with the public. So it was a lot of that stuff. And again, a lot of things about whether or not HIPAA actually is applicable in these situations. And in some of the articles, it didn't seem like it was, that you are required to tell your employee what your illness is that prevents you from wearing a mask. So yeah, it was interesting reading. So I'll definitely send that along.
Right. Let's see. We did have a couple of other pieces of correspondence. We had one related to Buckley and Mann. Some water testing apparently was done, and they were looking for a class of compounds called PFAs. For those who don't know what PFA stands for, I'm not sure if it's going to help, but the detailed name is either per or polyfluorinated alkyl substances. Essentially things that are used mostly for coating materials to make them either waterproof or dirt-proof, grease-proof. In fact, for a number of years, an active ingredient in Scotchgard. Not anymore. But anyway, pretty widely used materials. And if you looked at the data they sent us, apparently some water samples in the Buckley and Mann area had something like, the biggest number I saw was something like 5 nanograms per liter, which is a reference, is parts per trillion, which ain't much. And I was trying to figure out what does that really mean. And so I did some searching, and all I could find was a health advisory value that the EPA published back in 2016, which I'll treat as being somewhat reliable since it's before the current occupant at the White House was there. And it said that if you were drinking water over the course of your life that contained 70 nanograms per liter, you'd be okay. So in that context, the numbers they're finding down there seem pretty small. Smaller than small. Anyhow, we've not heard anything from the neighbors, but I just passed along that bit of chemistry trivia for anybody who's interested. That's all I had. Anybody else got anything they want to talk about?
No, we had our annual flu clinic.
Oh, yeah, the clinic class on the 7th, right?
Yeah, last Wednesday. Actually really, really smooth. I had a lot of compliments on how organized it was. It was great. So we probably did, I don't know, 80 to 90 flu shots.
Oh,
Great.
We had some people, there was a shortage of the high dose. So we had some people that walked away, because they weren't able to get it because we ran out
That's
of.
too bad. Hmm.
Yeah, one gentleman was rather upset because he was under the impression that he had made a reservation,
Hmm.
that he was guaranteed to get one. So, but that was out of our control. So,
Yeah.
but anyway, no, we ran it as a emergency dispensing site drill, so that I think we're pretty well prepared in the event that we have to dispense COVID vaccine in the future here.
Mhm.
So I'm pretty confident that we can do that.
Good.
That's about,
Glad it went well.
yeah.
Well, except for running out of the high dose.
Right. That, like I said, that was out of our control, and
Mhm.
I knew that I had heard that there was a shortage. So,
Well, I hope the whole town, everybody on the line here been inoculated.
Flu, I got my flu shot on Monday.
I already had my flu shot the end of September.
All
mine
right
was
then.
Wednesday.
How about you, Betsy?
Yeah, I got mine at the flu clinic.
At the clinic? All right, we're 4 for 4. That's good.
Good.
Upholding the border health standards here.
Yeah, interestingly enough, back to the COVID, I just got an email from the town of Franklin. They've closed the library due to a possible COVID exposure, which is interesting because it's not open to the public. So I'm assuming it was
Oh,
it was an employee.
Worker,
Okay.
yeah.
Yeah. So anyway, let's hope we can avoid having to do that in any of our public buildings.
mhm.
Well, it's not quite quarter past yet. Do we have anything else we can talk about?
No, so we've got the election coming up on November 3rd, as we all know. So I did volunteer to work the day at the election poll because I know that staffing is an issue because there's a lot of seniors that are usually staffing the election, and so since I'm not compromised, I offer to work the election.
Good.
We did put a call out to our MRC volunteers today to see if we had any
Mhm.
people that wanted to volunteer to help, wipe down the booths between
Mhm.
voters and, hand sanitize on the way in and on the way out and things like that. So make sure people are social distancing and wearing masks and all that good
Mhm.
stuff.
Well, early voting starts on Saturday, so hopefully enough people will do the early voting also to limit the number of people on the 3rd.
Yeah, I know a lot of people will actually want to come on the day. So, but it's good that we have people have the option. So it'll be busy next week.
Yep.
I would sign up, except that I'm working that day. I checked my schedule and I already had appointments scheduled, so sorry. I was trying to convince the other person in the house to do it, but I'm not sure.
That's okay. Well, if he changes his mind, I'll find a job for him.
All right, or you can. I know you guys talk a lot, so feel free to remind him.
Yes, I actually saw him today.
Yes, yeah.
So
Well, let's see.
Well, here's another little piece of business. Yes, I did resign, even though I didn't get any feedback other than from Cheryl from the
There was no
B1 committee.
objections,
Yeah.
so,
Yeah, that was a challenge. So Rich and I still have to chat about that, but I did not show up to the meeting the other night.
okay.
yes, there was I don't know if you were at home last night when we had our planning board meeting.
I stopped in early to that because Rich had some question about his dog, so
Oh.
yeah. So yes, So I did, but then I left after that.
Restructure actually the B1 zoning working committee so that there is no longer a need for a Board of Health representative.
Perfect.
Good.
And so you're off the hook.
Thank you. Thank you. Yes. I appreciate that.
Yeah, I know. That was a tough one, so.
So our opinions are not considered relevant to the work that they do, or?
Oh, that's not at all the reason.
No? No.
It was a myriad of factors. It was a challenging committee. The work was interesting, but I really had no background or basis. I didn't feel like was contributing very much. Some of the public contributions were difficult to manage. So.
Mhm. Yeah, I don't blame you there, so.
I figured for everybody's sanity, I would just back quietly away.
So I know. I felt bad that you ended up getting kind of stuck with that committee. But anyway, live and learn, right?
There you go.
It was a learning experience for you.
Exactly.
Oh.
Well, you know what? My schedule in the last few months has loosened up considerably, and if Rich would like somebody from the Board of Health to be on that committee, I'd be okay with signing up.
Okay, I'll let them know. Like I said, I think it's going to be they're looking to restructure it a little bit. So
That's fine too. But if they do need somebody or feel like they want somebody from the board.
Yeah.
Or you could
Only
even
little
participate as a public member as well, just if you were interested in just sitting in and listening and contributing. So there's public invited. You can just join in.
Yeah, well,
Just to see what it's like maybe before you volunteer.
well, I can always, pull an Eileen out of it and just say, well, this is not working. Pack up my marbles and leave.
stay tuned. I think you'll see it's going to be restructured, and
All right, that's fine.
I think they need to a little bit.
Well, in the meantime, actually, I couldn't be around for a little while. I'm just about to head south for a couple of weeks. Me and my boat.
Good. Sounds like
Which is the
fun.
reason why we had to move up the meeting. Although it turned out because of some other things, we could have met next week anyway. Sorry about that, guys.
Oh,
In the meantime, yeah, I should be back in time though for the activities on November, what's our meeting date, 13th?
Guess I don't have the agenda in front of me. I know, yeah, the 13th, I think we changed it to.
Monday, the 16th.
16th.
Monday, the 16th, rescheduled due to a
Right.
town meeting on the 17th.
That's
Yeah.
right. I think that's town meeting. I'm not 100% sure now, so, but we'll see.
Okay, that should still be okay.
Great.
All right, so we'll meet then.
Okay.
Nothing else? Apparently not. Is there a motion to adjourn?
I make a motion to adjourn the Board of Health meeting October 14th, 2020.
Second?
All in favor?
Aye?
Aye. We are adjourned at 7:19.
Okay.
Wow.
Gotta be a record.